Alone during a heart attack. Follow these 5 critical steps to stay alive. A strange tightness in the chest. Not quite pain, but something heavy, pressing down like a weight that can't be lifted. A deep discomfort, creeping outward, reaching into the arm, the jaw, even the back. The breath shortens, not because of exertion, but as if the body suddenly forgets how to take in enough air. Cold sweat breaks out, drenching the skin. A wave of dizziness, a nausea that feels like indigestion but somehow worse. A moment of hesitation. Could it just be stress? Something you ate? The mind races, debating, doubting. But the body knows. And in this moment, every second counts. Recognizing the signs, when to act immediately. Heart attacks don't always announce themselves with crushing chest pain like in the movies. Some come in whispers, mild discomfort, a vague sense of unease, a tightness that comes and goes. Some strike with full force, an intense, unrelenting pressure in the chest, as if an iron fist is squeezing the heart. The pain might radiate to the left arm, but it could also move to the back, the jaw, or even the stomach, mimicking heartburn. For some, there's no pain at all, just sudden breathlessness, overwhelming fatigue, dizziness, nausea. Women, in particular, often experience subtler symptoms, an unusual sense of weakness, discomfort in the upper back, shortness of breath even while resting. Diabetics may not feel any chest pain due to nerve damage. And sometimes, the first symptom is the worst one, sudden cardiac arrest, no warning at all. That's why it's crucial to act fast at the first sign of trouble. If any of these symptoms last more than a few minutes, or if they come and go unpredictably, assume the worst and move to the next step. Because waiting is the deadliest mistake. Step 1. Call emergency services immediately. The first instinct might be to brush it off, to see if it passes. Maybe it's just a panic attack, or something minor. But every minute that passes without treatment means more heart muscle is dying. Calling emergency services, 911, 115, or the equivalent in your country, is non-negotiable. 1. Clearly describe the symptoms. Is the pain constant or does it come and go? 1. Is there difficulty breathing? 1. Any history of heart disease? 2. Don't hang up too soon. 2. The dispatcher may have life-saving instructions to follow before help arrives. 3. Even if the pain seems to ease, do not cancel the call. 3. Some heart attacks come in waves, with the next one worse than the first. If calling an ambulance isn't an option, someone needs to drive the patient to the hospital, but never drive yourself. A heart attack can cause sudden loss of consciousness, putting everyone on the road in danger. Step 2. Stay as calm and still as possible. Panic speeds up the heart, increasing the heart's oxygen demand, the exact opposite of what's needed right now. Staying calm and keeping the body as still as possible reduces the heart's workload. 1. Sit down with your back supported, slightly upright. 1. Lying completely flat can make breathing harder, while standing or walking could strain the heart. 2. Loosen tight clothing to allow for easier breathing. 3. Avoid sudden movements. 3. The more the body moves, the more strain is placed on the heart. 3. If lightheadedness kicks in, lying on the side can prevent a dangerous fall. 4. Keep your phone close in case symptoms worsen and additional help is needed. Step 3. Take aspirin, but only if safe. If aspirin is available and there's no allergy or history of bleeding disorders, chew a 325 mg aspirin, or 481 mg baby aspirins, immediately. 1. Chewing, rather than swallowing whole, speeds up absorption into the bloodstream. 2. Aspirin helps thin the blood, preventing the clot from growing larger and reducing further damage. 3. If unsure about whether it's safe, wait for emergency responders to decide. However, never take aspirin if there's an allergy, a risk of internal bleeding, or if another blood-thinning medication like warfarin has already been taken. Step 4. Get someone to stay with you. Being alone during a heart attack adds another layer of risk. If possible, call a neighbor, friend, or family member to come over while waiting for help. 1. They can help monitor symptoms, keep you calm, and provide information to paramedics. 2. If consciousness is lost, they can perform CPR, a crucial factor in survival. 3. Even their presence can help reduce panic and anxiety, keeping the heart from working harder than it needs to. Step 5. Learn to prevent the next one. Surviving a heart attack is just the beginning. Preventing the next one is just as important. 1. Improve diet. Cut down on salt, sugar, fried foods, and processed meats. 1. Increase fruits, vegetables, whole grains, and heart-healthy fats like olive oil, nuts, and avocados. 2. Stay active. Aim for at least 150 minutes of moderate exercise per week, brisk walking, cycling, swimming, plus strength training to maintain cardiovascular health. 3. Manage stress. Chronic stress raises blood pressure and damages arteries. 3. Deep breathing, meditation, yoga, or simply taking breaks from overwhelming situations can make a difference. 4. Quit smoking and limit alcohol. Smoking doubles the risk of heart disease. 4. Excessive alcohol raises blood pressure. 4. Cutting back significantly improves heart health. 5. Get regular checkups. High blood pressure, high cholesterol, and diabetes often show no symptoms until it's too late. 5. Routine screenings can catch problems early and prevent future heart attacks. A heart attack doesn't wait. Knowing what to do in advance could save a life, yours or someone else's. Recognizing the signs, calling for help without hesitation, staying calm, taking aspirin, if safe, and having someone nearby, these 5 steps could mean the difference between life and death. Preparation starts today. Learn the signs. Make a plan. And if the moment ever comes, act fast. Because every second matters. Panic fuels the crisis. Staying calm is survival. The heart is already struggling, and every unnecessary movement, every anxious breath, only increases the demand for oxygen. Sitting down immediately, back supported, body slightly upright. Not fully lying down, this could make breathing harder, but not standing either, as movement forces the heart to work harder. Loosening any tight clothing, belts, ties, scarves, buttons, anything that restricts air intake. The lungs need all the space they can get. No sudden movements. Resisting the urge to pace, to shift restlessly, to walk it off. Walking increases strain on the heart, worsening the damage. If dizziness creeps in, lying on the side instead of the back can prevent choking if nausea turns into vomiting. Keeping the phone within reach, not in another room, not buried under papers, because symptoms can escalate in seconds, and losing access to emergency help could be fatal. A single pill could buy time. Aspirin, if available, is a lifesaver. It doesn't stop a heart attack, but it slows its deadly progression, buying precious minutes before medical professionals take over. If there's no allergy, no history of stomach ulcers or bleeding disorders, chewing, not swallowing, a 325 mg aspirin, or 4 baby aspirins, is the fastest way to get it into the bloodstream. Chewing breaks it down instantly, allowing absorption through the mouth's lining rather than waiting for the stomach to process it. But if there's any doubt, an allergy, a prescription for blood thinners, waiting for paramedics to decide is the safest choice. No one should face this alone. A quick message, a call, even a knock on a neighbor's door. If an ambulance is coming, having someone outside to meet them shaves off valuable seconds. Directions to the right apartment, the right house, the right floor, it all makes a difference. If symptoms worsen, if consciousness fades, having another person nearby could mean immediate CPR, one of the biggest factors in survival. And beyond the medical aspect, the presence of another person can help ease panic, slow breathing, and prevent fear from worsening the crisis. Surviving is one thing. Preventing the next attack is another. Every bite of food either helps or harms. Less fried food, salt, and sugar. More leafy greens, fiber, healthy fats like olive oil and nuts. Blood pressure and cholesterol levels respond directly to diet. Cutting back on processed foods, red meat, and added sugars can dramatically reduce risk. Movement strengthens the heart, not just intense workouts, but simple, consistent activity. 150 minutes of moderate exercise a week, walking, swimming, cycling, plus strength training to maintain muscle health. The heart is a muscle, and like any other, it weakens without use. Stress is a silent killer. Cortisol, the body's stress hormone, damages arteries, raises blood pressure, and increases inflammation. Finding ways to control it, deep breathing, meditation, yoga, even moments of silence away from the rush of life, can significantly lower heart attack risk. Smoking doubles the chances of heart disease. Alcohol raises blood pressure. Cutting back on both could be the difference between another attack and a longer life. Regular checkups catch dangers before they escalate. High blood pressure, high cholesterol, diabetes, these don't always have obvious symptoms. Many people don't realize they're at risk until a heart attack strikes. Routine screenings, blood tests, and doctor visits can reveal hidden warning signs and allow early action. A heart attack doesn't announce itself. It doesn't wait for a convenient time or send a warning in advance. But preparation, knowledge, and action can change its outcome. Recognize the symptoms. Call for help without hesitation. Stay calm and still. Take aspirin if possible. Reach out to someone nearby. 5 steps. 5 choices that could mean the difference between life and death. A decision made in minutes, a life saved for years to